So once again, welcome everyone. My name is Rosa Villegas, and we are very lucky to have two great presenters today who are going to be sharing information with you about health insurance. We're going to have Kari Mendoza from Relations and April from Pasadena Health Center here at the college. So I'll have them introduce themselves to you, and then we're going to get started with the actual presentation. But welcome and thank you for being here with us this morning. Kari?
All right, great. Well, thank you, Rosa. As Rosa said, my name is Kari Mendoza, and I am your account manager with Relation Insurance. We are the insurance broker, meaning we go out and we find the best insurance for you on behalf of the school that meets all of the requirements of your visa. So let's go ahead and jump right in and learn about your insurance. One of the questions that I get asked all the time is from international students is, why do I need medical insurance? Why is it important to have medical insurance in the United States? Well, there's two main reasons. Number one, medical care is extremely expensive here in the US, and it's a very complicated piecemeal system here in the US. Many of you are coming from countries where you're probably used to socialized medicine, where you go to one place for all of your care. Well, we do not do that here, and we're going to go into a lot of these details in just a few moments. But when I say it's expensive, I want to give you some foundation of just how expensive it actually is. Whoops, what happened there? The average cost of an emergency room visit is now in the US is now over $2,000. So that's to go walk into the ER, to the emergency room, and be seen. Typical ambulance rides. Well, ambulances, honestly, the price of an ambulance varies greatly from county to county, state to state, but you're typically looking at anywhere the range from $600 to $1,200. That's for an ambulance to pick you up from one location and deliver you to an emergency room. Average cost of a doctor's visit. So when you have a sore throat and you want to go to the doctor, the national average cash price is now over $200. So without adequate medical insurance, you would be expected to pay this, which is just unaffordable. That is why Pasadena City College took kind of an extra step to protect all international students from, there's a lot of companies here in the US that will sell what we call a travel insurance policy. Travel insurance policy is not medical insurance. In fact, it has caps on everything. So you might find that it's really inexpensive compared to maybe this plan, to purchase a travel plan, but really that's only one piece of the puzzle. You have to know, what is it going to pay? So travel plans typically have a dollar limit. Maybe they're only going to pay $100 for each doctor visit. Well, you can see from my screen, the average is over 200. So you would be expected to pay that balance. So it's really, really important anytime you're here in the US, even beyond, even in the future, always make sure you're covered under medical insurance. We have surveyed the market. We have very high quality medical insurance that's affordable for you. So I want to start out by telling you a couple of important contact informations. Relation, which is my company, Relation Customer Service. If you ever have any questions regarding eligibility, like, you know, are you showing eligible in the system? Any kind of questions like that, you want to call Relation Customer Service. If you have benefit or claims questions, you're going to actually call Geoblue Customer Service. So your insurance is what the name I want you to remember is Blue Cross. It's Blue Cross PPO, Preferred Provider Organization. When you are going to talking to a doctor, you're going to want to make sure you're only going to Blue Cross PPO contracted doctors. Okay, and we're going to get into this a lot in just a couple of minutes. But Geoblue is the company, Blue Cross is the product, or what the insurance is called that you actually have. Okay. We also have all of our documents, all of your plan materials, all your reference materials. I even have a video very similar to this one on your microsite. It's on our website, forstudenthealth.com/PCC. So if we have time, I can show that to you as well today. But it's kind of one-stop shopping for all of your questions. Like I said, there's about a 10-minute video on that site. You can scroll down and you can find all the plan materials as well. They're all housed there. Now, I had alluded to the medical system here in the US being very complicated, and it is. It has its own definitions as well. So I want to briefly review that. A maximum benefit, what that means is that's the largest total amount your plan will pay per person per plan year. Now, your plan, we're going to go over that in just a few minutes, but let's just cover through the definitions. So covered percentage or co-insurance, that is your share of the cost, and it's calculated as a percentage. So co-insurance always has a percentage after it, like 20% co-insurance, where the opposite is a copay. A copay is a flat dollar amount. So maybe your office visit is $25 each time you go. So a copay is a fixed amount you pay for a covered health service at the time of your visit. So that's really important. Make sure you're always, when you go to the doctor, if you make an appointment or say you go to the urgent care, they're going to expect you to pay that copay up front. Okay. Your out-of-pocket maximum. Out-of-pocket maximum is a good thing that you want on your policy, and you want that number as low as possible. So the out-of-pocket maximum is the most that you're going to pay out of your own pocket before the insurance starts to pay 100%. Okay. Your out-of-pocket maximum, I believe, is $5,000. So once you pay $5,000 in your copays and co-insurance, then the insurance would pick up at 100%. Now, keeping in mind, your plan is a very high quality plan, very low cost to you plan. So you will probably never hit your out-of-pocket maximum, which is good. That means you're healthy. But for those of you, maybe you have a catastrophic medical situation happen, that's where that would come to play. But again, most of you are never going to hit your out-of-pocket maximum. Medical evacuation and repatriation of mortal remains is global assistance services that provides emergency medical assistance and travel assistance back to your home country should you need it. Again, most of you are never going to need this, but this is actually to keep you in compliance with your visa regulations. So that is something special that Geoblue as a company handles very, very well. Okay, so all of you hopefully already have your ID card, your medical ID card. That is super, super important. Carry it with you or have access to it all the time, because anytime you use services here in the US, you want to make sure you give the provider your Blue Cross or your Geoblue, you'll see Geoblue logo on the top, your medical ID card, okay? Your certificate ID number, you should have all received an email at the beginning of the semester that will have your certificate ID number. Every student's going to have a unique certificate ID number, or that's also called your member ID number. Okay, so you need to have that when accessing your ID card. So watch for the welcome email from Geoblue if you haven't already gotten it. Or you can log into geobluestudents.com and create your account. Okay, once you create your account, you can download your ID card. Make sure to keep that certificate number with you. If you have any trouble, feel free to give me an email or a call, or you can even call Relation Customer Service. All of our customer service agents do have access to Geoblue's system and can help you get your ID card if you need it. Okay. So again, please, please, please be sure to always carry your medical ID card with you, because we never know when we're going to be when we could be potentially be in an accident. If you go to the ER, remember, ER is thousands of dollars. You do not want that bill. I can guarantee you that. You want the insurance to be billed. Okay. And if any of you have any questions, feel free to unmute yourself and just ask, okay? We want this to be very interactive, and we want to make sure we get to all of your questions. Okay, now, many of you come from maybe a healthcare system or your country, your home country. Maybe you are assigned one clinic or one hospital where you get all of your medical care. Okay, we absolutely do not do that here in the US. Okay, in fact, the hospital is the very last place we would go for a healthcare situation. We kind of have an order that we go into. The emergency room is the single most expensive way to obtain medical care. So we save that for very serious or very life-threatening emergencies only. Okay, so you guys are very fortunate at PCC. You have a student health center. We do recommend you start there whenever you need care. It's the most affordable, and they can see you for minor illnesses or injuries. And April's going to talk to you about that in a little bit. But you might just want to call before going over there to make sure they're open. With the pandemic, their hours could be different. So then the next level is a doctor's office visit. A doctor's office, you would go for any kind of medical concern or sick visit. Those are, you call ahead and you make an appointment with the doctor, and you will want to make sure it's a Blue Cross PPO, or you might hear it called Blue Cross Prudent Buyer. All the same thing. Okay, so we want to go to those contracted doctors only. Next is an urgent care center. So urgent care center, you do not need an appointment for. That would be if you woke up and you were feeling sick and maybe your doctor can't get you in right away, or maybe it's the weekend. Okay, most doctors' office are closed on the weekends, so you could go to an urgent care center. Now that is for an illness or injury when your doctor's office or the campus health center is closed. But it's not a life-threatening emergency, right? It's something minor. Maybe you have an ear infection and you've had it before. You know exactly what you need. You need an antibiotic, let's say. You might go to urgent care center for that. Hospital, again, is for scheduled surgery or a true medical emergency only. So a reminder again, emergency room visits are 2 to 3 times more expensive than a doctor's office or urgent care. If you do find yourself in a situation where it's not life-threatening, but you do want to go to an urgent care, I have 3 on the screen right there that are contracted with Blue Cross PPO. So those might be good options for you. Again, please call ahead of time before going to the urgent care, just to verify that they are seeing patients with COVID. Many of them are changing kind of their operating procedures at this time. Okay, and of course, in a life-threatening emergency, you're going to call 911 for an ambulance, or if you can get yourself safely to the nearest emergency room, you will want to do so. Any questions on that? Please feel free to speak up. Okay. Let's really quick before I move on, some typical reasons why you might go to an emergency room here in the US. Maybe you're having chest pains. Maybe you're having excessive bleeding. Maybe you feel like maybe you have a broken bone. Now, most broken bones aren't considering life-threatening, but ER is still appropriate for a broken bone because they are best equipped to handle the nature of that emergency, right? They have an X-ray equipment. They have a doctor that can, set the bone and cast the bone. So when in doubt, please be seen. Okay, that's my biggest message. You have insurance to cover it. Healthcare, again, is not free. You will pay for part of the bill, but the most important thing is to always take care of yourself and listen to your body. So if you know that there's something wrong, please be sure to get seen by a doctor. Okay, we don't want you to be sick or have any kind of major health concern. We want you to be able to finish school. So please don't shy away. There's so many of us, Rosa and her team, me and the relation team, we're all here to help you and guide you. And that's what we're here for. So if you have a question, please don't sit and suffer in silence. Come and talk to us. Okay, so remember I said your insurance is Blue Cross PPO. Blue Cross is the largest largest provider network. Provider is a doctor, a hospital, an urgent center. That's urgent care center. That's what we mean when we say a provider. So they're the largest nationwide. So even if you're traveling, maybe you're in spring break in Florida and you need a doctor, there's Blue Cross doctors there. So that's one huge advantage that and why the school chose Blue Cross as your network. So Blue Cross PPO or Blue Card PPO, these are all the same things to you. So when you're using a contracted or in-network provider, most everything's going to be covered at 100%. Okay. Minus copays, of course. If you are using an out-of-network provider, meaning one that is not contracted with Blue Cross, the insurance is going to pay 80%. Okay, you're going to be responsible for 20% co-insurance. Okay, now to find a Geoblue or a Blue Cross contracted provider, you can go to geobluestudents.com and there's a find a provider button. And then you're going to click on US providers. You're always going to use the QHS. That is your, what we call a prefix. That's your code. So when you're looking in the provider directory, you always want to put in QHS. And again, we can, if we have time, we can go through that as well. Okay. Even if you find the doctor on the Blue Cross directory, it's still a good idea to verbally confirm with that doctor when you make your appointment, hey, you're still contracted with Blue Cross PPO. One tip of advice, and this is pretty important, okay? When you're talking to a US provider or their office, do not say, hey, do you accept Blue Cross? That is very different than saying, are you contracted with Blue Cross? All providers will pretty much that do any kind of insurance billing for their patients will accept Blue Cross. All that means is, yes, we will bill for you. But when you say, are you contracted with Blue Cross? You're asking if they have a contract directly with Blue Cross that's going to protect you financially. Okay. So really important. If anybody doesn't understand what I said right now, please speak up, because this is going to save, that one piece of advice will save you, could potentially save you hundreds of dollars. Okay. So you always want to use the correct terminology, which is, are you contracted with Blue Cross PPO? Okay. All right. Now, I'm a big proponent for being prepared. So this is my second piece of advice to you. Right now, before you need the insurance, start thinking about this. Start developing a plan of action. Say, okay, when I'm sick, who do I go? Where do I go? Do I have my medical ID card? Right? So go and spend a few minutes looking at this information now, right? Read about the insurance on our website. Find your in-network doctor, find the closest urgent care to you, find the closest emergency room to you, because I can guarantee you when you're sick and not feeling well, these are the last things you're going to be wanting to do. You're going to want to just get to the doctor, feel better, right? So spend some time thinking about this stuff now. Okay, so it's really important to understand how this all comes together, right? Like how does this bill get paid, right? So again, this is why I only want you to ever use Blue Cross providers, because they're going to send the bill for you. Okay, the contract with them is going to protect you, and they're also on the hook for billing for you. So you're going to already have downloaded your Geoblue ID card. So you make your appointment with the doctor. Okay, you show up at least 15 minutes before your appointment time. Your doctor's staff is going to ask you for a copy of your medical ID card. They're going to have paperwork for you to fill out. So make sure you show up before your appointment time. Okay. So the doctor's going to see you. And then when you leave, the doctor's going to submit a bill on a special claim form to the insurance company for payment. Okay. The insurance company is going to process that bill. Okay. And they're going to mail you what is called an EOB, or an explanation of benefits. And that is not a bill. You will never receive a bill from Geoblue. Okay. What that is an explanation of how much the doctor sent in, to how much was the bill, what the insurance company paid, what amount the doctor has to write off because of that contract, and any amount that you owe. Okay, so any amount that you owe, the doctor's office will send you a bill for that amount. Okay, so you're going to pay your copay up front. And then if you owe any money on the back end, the doctor will send you a bill. Now, my tip of advice to you, if you have not received the explanation of benefits and the doctor sends you a bill, do not pay that bill yet. Wait until you receive the explanation of benefits before paying the bill. Geoblue will always tell you exactly what you owe. The doctor, if they're contracted, will be obligated to write off a significant amount of the balance. Okay, so if the doctor is billing you and Geoblue says, nope, you owe $25, and the doctor's billing you for $100, that's when you come to me and get me involved. Okay, that's when I want you to call me, email me, text me, whatever, however you do it. I don't care, but let me help you resolve that. It makes it much harder if you've already paid the bill. Okay, and then we have to try to get your money back. So don't do that. Okay, let's make a pact that you're going to get in touch with me if you have a problem like that. Okay. Okay, you can always call Geoblue customer service. If you know that you haven't received the explanation of benefits, you can call their customer service line and they can help you. They can tell you, hey, this wasn't processed yet, or it was processed. They'll tell you exactly what you owe, all of that. So that's another option for you. Okay, with all of that said, I did not just give you permission to just throw the bill in the trash. Okay, keep it in mind that every time you go to the doctor, there's a bill going to be generated. Every bill, you should receive an EOB. So if you haven't received the EOB after 30 days, call Geoblue and say, hey, I went to the doctor and I haven't received the EOB yet. Okay, it's always your responsibility for payment of any charges incurred here in the US. Okay, so what that means, if the insurance doesn't pay for it, you are on the hook for that legally. Okay, so don't ignore it. Don't ignore bills. We don't want you to end up in collections. If you keep ignoring the bill after 90, 120 days, they will send it to a collection agency. And you don't want to do that. Okay, so let's not go down that path. So get us involved, get me involved early if you suspect a problem. Okay, if you have to submit a claim, maybe you're using a non-contracted provider or a non-Blue Cross provider, they do not have to do the bill for you. They can charge you up front, and then you would have to submit a bill on your own. If you do, go to our website, forstudenthealth.com, and you can download a claim form. Again, Blue Cross is the largest network nationwide. In my opinion, there's never a reason to go out of network. It will save you. It will end up costing you. It will always cost you more money if you do. So we kind of talked about the process, why medical insurance is important, but let's talk about the actual benefits, okay? So if you go
I
to
have a question, Carrie,
sure,
before you move on. So the
sure.
question is, does the insurance cover eye, vision, and dental?
Okay, great questions. No, it does not. So vision here in the US, we have different insurances for different things. We have medical insurance, we have dental insurance, and we have vision insurance. Okay, this is a medical insurance plan. We do have, there are some voluntary individual plans. So this is a group medical plan, which is very different than an individual plan. Okay. Um, but if you are interested in dental and vision coverage, you can purchase individual voluntary dental and vision plans. Now, my word of caution on that, I'm not a big fan, to be real honest, I'm not a fan of either of those. Insurance is basically you need enough dollars to cover the claims cost. So if you're only spending $100 on dental, you know, they have to put a bunch of limitations and waiting periods on it. Otherwise, they can't afford to offer the insurance, right? They can't pay out thousands of claims when they've only received $100 in premium. So there's a lot of exclusions, limitations. My personal advice is look for alternatives. Again, feel free to go to our website. You can go to our forstuddenthealth.com and click on supplemental plans, and there's voluntary dental and visions. I don't like either. I don't like any of them, to be real honest. I have found, and from talking to with many students, that you can often do better at Costco for vision. You do not even have to be a Costco member. They have vision clinics. You can get discounts on glasses, you know, very substantial. Dentists, you can sometimes find, you know, dental cleanings at dental schools. I believe PCC has a dental school for cleanings and stuff like that. You can also, as a cash, for people that don't have insurance, call around, call different dental offices and tell them that you're a cash paying patient. And oftentimes, if insurance isn't involved, they will offer big discounts. Okay. Does that help, Rosa? I kind of probably went a little bit off on a segue there, but okay. So if you're going to Blue Cross PPO provider, there's a $25 office visit copay. And of course, that's waived at the Student Health Center. And that's same with urgent care. If you're going to a Blue Cross contracted urgent care, $25. ER visit is $100 copay. So again, copays you're going to pay right there when at the time of the visit. Now, if you go to the emergency room and the emergency room doctor says, hey, we need to keep you here overnight, we are going to actually waive that emergency room visit. Okay, copay. And instead you would have a hospital office visit, which in this plan is actually $100 as well. So your out-of-pocket maximum is $2,500. So that's even lower than what I was thinking. So that's really good. So once all your co-insurance and copays equal $2,500, you're done paying for that year. Everything would be covered at 100% if it's Blue Cross. Now, if you're using out-of-network, you notice my column, how I wrote that. I said you will pay at least 20%. That's really important because I can almost guarantee you will end up paying more than 20%. And this is the reason why. Because there's no contract in place with the provider is legally able to do what we call balance billing. So they can say, okay, our charge is $200 for an office visit. Since we're not, let's say Geoblue, the Blue Cross rate, let's say, is $100. Blue Cross is going to pay, if they're out of network, they're going to pay 80% of the $100, which is their contracted rate. So the provider is going to bill you for the 20% of the $100, okay, or $20, plus there's no contract in place, so they don't have to write off that extra $100. So they can actually bill you $120, okay, in that example. So let's avoid all of that. Only go to Blue Cross providers. There's no shortage of Blue Cross providers. Just don't go out of network. Don't do it. It's not worth it. Just go to the in-network doctors. Prescription drugs it's a copay, it's a reimbursement plan. So basically what that means is you pay for the prescription up front and then submit the claim to Geoblue and they'll pay you half of what you paid. Okay, so it's 50%. Contraceptives, of course, are covered at 100%. Now, really important, this plan is what we call an accident and sickness plan. Okay, so what that means is it covers anytime you are in it, have an illness or an injury. Okay, so preventive care, most preventive care is not covered. Now, there's an exception for immunizations. We added this to the plan a couple of years ago. This is how we keep the premium or the cost that you pay up front down low. Okay, so immunizations are covered if they're recommended by the Center for Disease Control. Okay, so if you go to a doctor and he says, hey, I want to do a routine annual physical, tell him no, your plan does not cover that. Okay. All right, so your prescription drugs. So basically you can go to any pharmacy you like, CVS, Rite Aid, Walgreens, Walmart. You pay for the full amount of the prescription up front and then submit a claim for reimbursement. And because you're paying for it up front, don't be afraid to use discount cards. Like GoodRx is a really popular one. If you Google GoodRx and you put in the name of the drug you need, it will pop up. They can pop up a discount card. Feel free to use those. That will save you money. Another way, make sure you're only getting generic drugs. That is a huge cost difference. Again, Costco, even if you're not a member of Costco, the warehouse shopping, you can still use their pharmacy. It really, really pays to price shop on drugs, especially if they become very expensive. Some drugs here in the US are tremendously expensive. So price compare, shop. What I like about GoodRx is it will actually do the price comparing for you. It will show you this drug at 5 or 10 different locations. So it really pays to shop around. And again, if you have any questions, please feel free to call our relation team members at 800-537-1777. You can, as I alluded to earlier, this coverage goes with you. The Blue Cross network is huge. So even if you're outside of California, you're going to get the same benefits. So it's be covered at 100% minus your copay. As long as you're using in-network or contracted providers. Out of network, same thing applies. 80% is the payment from the insurance. Again, no matter where you are, it pays to use Blue Cross. After you complete your course of study here at PCC, you may be eligible to continue your insurance if you're an OPT student or optional practical training. Now, OPT runs a little bit different than what you're used to as a full-time student. As a full-time student, your health insurance is charged on your student account. For OPT, it is not that way. OPT, you're going to enroll right on our website. Okay, forstudenthealth.com/PCC. You're going to enroll with a credit card. There's a separate enrollment little you click on a separate icon and it will clearly say OPT enrollment. That's where you are going to enroll. The system will ask you to upload your I-20. We cannot, our eligibility team cannot process your enrollment without your I-20. Please, if this applies to you, if you are going to be in OPT, Please be mindful of the deadlines, okay? You only have 30 days after your termination of insurance as a regular student to enroll in OPT. We cannot make exceptions on that, okay? OPT is set in stone. You have 30 days. Don't come to us 40 days later and say, hey, I want to enroll, because we cannot make any exceptions, okay? All right, that's pretty much my presentation. I do want to close with our customer service number, 1-800-537-1777. And if you have any questions, again, I'm Kari Mendoza. My email is Kari, Kari.Mendoza, MENDOZA @relationinsurance.com. And I'll put that in the chat as well. Okay.
Awesome.
Kari, do you guys have any questions that you want to ask Kari right now? Feel free to unmute yourself, or you can put them in the chat.
No? Okay, well, I will turn it over to April then. Thank you, everyone.
Excellent. Thank you so much. Let me just share screen. Let me pull up my presentation. One second. Just go ahead. Okey doke. Okay, can you guys see my screen okay? Okay, excellent. Okay, so my name is April Forrest. I'm so sorry that unfortunately I'm having some bad internet connection, so I can't have my face on screen. I really wish that I could, so I could, I guess you guys could see all of my excitement to be here today. So while you're here at PCC, we're going to talk about your health. And some of the services that we offer at Student Health Services. Again, my name is April Forrest, and I'm a health educator. So Student Health Services, after 2 years of being off campus, we offer in-person services as well as telehealth services. So does anybody know what telehealth services are? Anybody want to take a crack at it? Okay. All right, so telehealth, so it's quality health care service that you can get from home. It is a way to offer healthcare services from home that we can offer that you can actually get through either your computer or your smartphone. So Student Health Services will continue to address medical concerns through telehealth. So you can either use, again, your telephone if you have a smartphone. They can be in contact with you through your email, or you can even have a Zoom appointment. And so basically you would call and you could schedule it. So it's by appointment only. And actually right now too, just because, you know, we're just opening up again for the first time, in person as well is going to be by appointment only. So these are our hours and locations. We are located in the D building. So I've got a big star right around it. Here I've listed our phone number, and these are our hours of operation. So Mondays, Wednesdays, and Thursdays, we're open from 8 a.m. to 4:30 p.m. And then Tuesdays, we're open from 8 a.m. to 7 p.m. and Fridays, 8 a.m. to 12:30 p.m. And here at the bottom, so I have our email address. So you can even just email if you have questions, comments, concerns. And again, the phone number is probably the easiest way to just get a hold of somebody immediately and make an appointment. So if you've never been in the D building, we're just down at the bottom. So this is what you'll see. We have the big Student Health Services sign out front, and you can just knock on the door. So if you've made an appointment, you can just knock on the door and somebody will let you in. And when you walk through the doors, this picture that's here on the right, this is what you'll walk into. So these are the windows, and you can check into your appointments here. I mean, as you can see, there's a ton of brochures out for just different information. So you can meet your educator. So I'm April. I can tell you a little bit about myself. Before I was with PCC, I worked for the American Lung Association, where I was a health educator there. Before I was at the American Lung Association, I have worked in teaching sexual health all over the world. The last place that I lived before being just here in the States, I lived in Vietnam, and I actually taught sex education to medical students. So that's a fact about me. So when I actually am a DRPH student, and when I am on campus, or when my campus was open, I worked in our education outreach center and really grew a passion for it. So I'm excited to be here at PCC. And then something I do with my free time is I volunteer with a suicide text hotline a couple nights a week. And I am, again, very excited to be at PCC, and just making it a healthier campus. Okay, so this is our staff. So we have a new health director, and her name is Mindy Throop. And so this is her over here. These are our two physicians. Dr. Ann Walker, she's usually around in the day. And then we have Dr. Brown, who's there in the evening. These are our nurse practitioners, Jonalyn and Valley. And then these are our RNs. So we have Carmita and Karen. These will be the people you run into. And then this is just some outreach that we've done just in 2022. So I'm fairly new to the school. I just started in November, but these are just some things that I've been able to participate in just since November. So we had an event called De-Stress. It was during finals week, and we just basically set up and had a bunch of information about de-stressing and keeping your cool during finals week. And then, we always bring out some goodies. So we brought out condoms and candy, and these are all free to students. Here we have a flu clinic going on, which we had at Welcome Week, and then we also had during the fall semester. And so again, those are just a couple of different events that we've had happening. So when you pay your student fees, just to go to PCC, you also pay a student health service fee. And so for a regular semester, it's only $21. And during intersessions, it's $18. So in order to use our services, the only thing you need to do is be a student that is currently enrolled in courses. So that would probably be all of you if you're here today. So these are the things that are free to you. So these are no-cost services that we offer at the Student Health Services. So we offer condoms, external and internal dental dams, over-the-counter medications, consultations. So one thing Kari said is physicals were not covered. So this is actually something that you can get in Student Health Services. They offer first aid services. So let's just, I'm sorry, did you have a question? Maybe it's just maybe an accidental unmute. So we have consultations, free first aid services. So basically what that means, if you're on campus and let's just say you have an accidental fall and you scrape your knee, you can come to Student Health Services and they'll bandage you up. And then they do HIV testing and HIV counseling. And then some of the low-cost services that they offer is birth control or emergency contraception. So if you need a Plan B pill, they do some vaccinations. So again, flu vaccines are free. So we still have a ton of them. So if you have not been vaccinated yet, please come down to Student Health Services. We do TB testing, and TB testing is a good one to know just because a lot of jobs will require it. So I don't know if different places require TB testing. And the great thing is you can go in on a Monday to Student Health Services and you come back a few days later and they'll be able to read it and take care of that right there for you. They do STI testing. So that's sexually transmitted infection testing, prescriptions, and they do blood work. And so this is just showing you kind of how to get to the website if you want to use Student Health Services. So you would come to this page, which would then lead you to the you go down and you go down to the student health. You'd go down to the student health services page. Something else that the school offers, and it's not through student health services, but that I wanted to offer, is the Lancer Pantry. So this is a place that you can go and get healthy, non-perishable food items. It's no cost to you, to students that may be in need. All you need is a valid PCC ID. And so you can also find that on the website. If you go to Pasadena City College and you hit that search button, you can just type in Lancer Pantry. Again, here's the location, the phone number, and the email address. But if you have any more questions or you want to look more into Lancer Pantry, you can just use the website. And these are just additional resources that you can get off the campus. So I can let you look at that list, but there's Planned Parenthood, there's the St. John Family Center, there's the UCLA Gender Health Program. So there's just a couple of other resources that I can show you. So again, there's, sorry, I don't know why my computer's moving itself. So there's some more programs here for low cost or no cost HIV and STI testing. And again, here is using the website. You'll go to Student Health Services and you can go to referrals and health resources, and you'll be able to pull up some of that information there as well. But here we go. And so it'll pull up your community resources, and then you'll be able to find everything here. So the ones that are in red, you just click one of those buttons and it can help you get to the information that you need. Okay, and you can also follow us. I run our Instagram, Facebook page. So we always have information about if we have flu clinics going on, or if we're set up at the quad, different events that we have going on. Something that we try and keep up on is just what is happening as far as COVID. So we try and keep like COVID rates up, talking about like the best mask to use. So there's always information going on our Instagram page. So if you can, or if you have Instagram, follow us at PCC Healthwell. If you have more questions, you can feel free to contact us. So I will put my personal email in the chat, but this is just a general email address, which is healthandwellness@pasadena.edu. This is the phone number. You can make appointments or if you have general questions. And then again, we're located in Building D, which is by the mirror pools. And we're just down at the bottom. So we're D105. And again, you'll see the big sign that says Student Health Services. And that is it for me. Are there any questions?
Thank you, April and Kari. That was great. So students, if you have questions, please unmute yourself and feel free to ask right now. This is the perfect timing.
Yeah, feel free to put them in the chat. Again, I put my email address. So if you, for some reason, aren't comfortable here asking a question, you can email me as well.
I do have a question that I've been asked before while students think about it. Can I use the insurance to go get tested for COVID?
Yes, yes, you can. So COVID testing, when medically necessary, you can again submit the claims for those. You'd want to go to our website to download a claim form. Again, that's the number 4 studenthealth.com/PCC. And you can make sure you submit the receipts as well. Okay. I'll go ahead and put in the chat too. I'll put our website.
Thank you, Kari. I'm going to stop the recording in case somebody wants to ask more questions that they're not feel comfortable asking if they're being recorded. So I must stop it and then you can ask questions.